portal. So hopefully all of you can hear me very well. And if there's any questions, please do just hold on to them and we can discuss at the end as well. So from the Medic Portal, we're an amazing company that helps lots and lots of students and aspiring medics into the medical world and dentists as well. And we have one of the most popular interview preps. So hopefully these seminars and a lot of the online resources we have are going to really pave the way for a successful interview season. So we've partnered with the Royal Society of Medicine to give you guys the best resources we can. So we're going to start with when are interviews. Now, I think when it comes to interviews, it can seem like a really daunting topic. So hopefully when we talk about when they're happening, what's going to happen and all those little bits and bobs, we can kind of debunk that worry and get ourselves on the right track. So you'll get invites anytime from November. It's very dependent on the medical school. Now, one thing I do want to put out there, which is very important, is that when it comes to when they release the interviews, everyone's a little bit different. And it's not necessarily, there's a big misconception that it's going to be, the first people to get it are the people they want the most, etc., etc. Or like if you don't hear by a certain time period, but your friends have, then it means that you're not going to get an interview. It's very, very variable. So, a lot of schools will kind of release them in batches just because they've got a lot of applicants to get through. So if you hear that one of your friends has an interview, but you haven't heard back yet, don't be alarmed. It's not necessarily a bad thing at all. It just means they have to work through a large volume of people. So interviews take place from kind of November period all the way through to March. And because that's such a big time period, it's also very important to remember that getting a later interview doesn't necessarily mean anything in relation to how much they want you. It's simply, if you've got thousands of people, you can't fit them into one day. So they really just need to take it bit by bit. So if you get an interview for later, it doesn't mean anything in comparison to getting an interview earlier. So some will interview over the course of 1 week. So sometimes I like to jam pack it, but like I said, some will do it over a few months. So your invite will be emailed to you. So please do keep wary of your emails and please do check your junk emails and your spams. It's very easy for things to get lost in there. So keep an eye on those emails. That's where they're going to get in touch with you. Most universities don't give you a choice of date. So unfortunately, that does mean during our Christmas periods, we may not be able to book any holidays. So just be very wary. Some people do kind of let you book interviews, some don't. So, and it's always, if in doubt, just go ahead and pop them an email and ask. But yeah, so we do recommend no holidays during the Christmas period, unfortunately. So going into the interviews themselves, there's kind of two obvious categories there's online versus in person. Now, starting with online, we have kind of, from COVID times, it really became a very effective way of going about doing interviews. Now, naturally, there's pros and cons. Some people find online a little bit harder to express themselves, and in person, some people find a lot more intimidating and daunting. But just bear in mind that, you guys have worked hard, you have all the right credentials. So if you are, wherever you're doing it, online or in person, just remain, very strong and just kind of keep yourself neutral and go from there, okay? So right now, from what we do have, these are the universities that we know are going to do online interviews. However, this is very variable, so please do check in with the universities, check their websites. If you're not sure, do pop them an email. And so, just check if you need to travel, because obviously if it's in person, you may need to travel. So think about, what your arrangements will be, what they can offer. And if it's online, just make sure a few of the key things: a stable internet connection, a classic, and also where you're going to do it and kind of the environment you're in. You want to make sure you're somewhere you can focus, where there's no distractions. That's quite important. So I'm a final year King's medic. And when I was doing my interviews, it was COVID time. So all of them were online. And I think it was quite important to find kind of somewhere that was that wasn't disruptive, there wasn't people coming in and out, etc. So if you find yourself in a bit of a predicament, so for example, if you don't trust your family members at home, or you've got a dog that likes to bark, you can definitely ask your schools if they're willing to give you a room to do your interview in. So that's what I did myself. Just so, because I wanted to make sure that I was in a very neutral place, I asked my school if there's a room they could book me, and that's what they did. So that's something that you guys can do if you want to do an online one. So the two type of interviews, which you'll very classically have heard of. So the first is MMI. So this is multiple mini interviews. So essentially, multiple mini interviews, exactly as the name suggests, you've got multiple mini interviews. So it's kind of a few short assessments. Now, each university does it a little bit differently. The number that you're going to get is a bit different. The kind of questions you're going to get might be a little bit different, but the general structure remains the same. So they're broken down into what we call stations, and each station is 10 minutes or less. So how it's going to be, if I was to visualize it for you guys, say there's 8 stations. Just imagine kind of 8 little rooms or 8 boxes or whatever it may be. And what you're going to do is you're going to start at 1, you're going to stand outside. There's going to be a little sheet which tells you what the room is about, whether that be a role play, whether that be about your skills or whatever it may be. And you're going to get 1 to 2 minutes each. Well, like I said, each university is different. You're going to have 1 to 2 minutes thinking time. You get to think, okay, what are the questions? Sometimes they'll put the question for you. Sometimes they're going to give you the category. And then once that time, and they're going to keep a time track. So they'll be like, okay, your 2 minutes is up. Go inside. You'll go inside. There'll be an examiner. They're going to do the station with you. Once you're done, there won't be any feedback on the station or anything like that. Once you're done, you go into the next, go towards the next room. You'll stand outside. Same thing. 2 minutes or 1 minute, whatever it may be, thinking time. You know what the station's generally about. Then you go ahead into the station. So there's a few kind of key things with MMIs that we'll come back to as well. Now, from room to room, there's no communication. So one interviewer isn't going to know how you do in comparison to the next interview. So they really do vary, but there's no kind of communication. So say, for example, you're doing one of the stations, you're like, oh my gosh, like I'm not too sure how that went. Shake off the nerves, you're on to the next one. No one knows except the people in that room, which is a great benefit of MMI. Now, the flip side is traditional interviews. Now, these are question-focused or task-based interviews. And instead of kind of the classic role plays or scenario communication task, you're going to be asked questions directly. Now, these you might know a little bit more along the lines of like panel interviews and things like that. So that's what they refer to there. Okay? So, traditional panels, what to expect? Let's have a look. So your interview will usually last between 20 and 40 minutes. Now, in terms of how long each one lasts, it's really dependent on the interviewer and what kind of questions they're asking. So please don't be alarmed if maybe yours overruns a little bit or goes a little bit shorter. So I myself, when I was doing my King's interview, mine lasted it was an MMI, but they did a panel format. And mine lasted about a grand total of 20 minutes. But I had friends who had it all the way up to 40 minutes. So it really does differ. And some of the common questions you're going to get are the really classic ones like, why do you want to study medicine? And if you weren't offered a place to study medicine, what would you do? So these are the kind of interview questions you can get. And we have a really great interview question bank that you guys can look at. So if you want to have a little feel of what those questions are, if you just search up the Medic Portal question bank or the interview question bank, we've got some really great resources on there which give you lots of examples. So with these traditional panels as well, it's going to be with the same interviews. Unlike MMI, you don't move station to station. So you'll be sitting in that room, and that it's kind of almost more of a conversation, like rather than ask a question and the examiner's going to sit there in silence and not say anything. They may ask follow-up questions and things like that. So that's one of the kind of positive. They do really get to know you a bit more in those traditional panels. So Oxbridge is a whole world of its own. And we've got MMI, we've got traditional, and then we've got Oxbridge. So the Oxbridge variant is a type of panel interview. So it's less focused on the very traditional questions like, why would you like to be a doctor? And it's a lot more on, as it mentions, scientific and logical reasoning. Now, as it mentions here, it's designed to find the best academic doctors. So it really does vary from the classic questions we get. But as many of you may know, Oxbridge is much more focused on things like kind of identifying who can think on the spot and problem solve, but in a much more scientific manner and more about kind of the academic and scientific aspect than the skill set. So Yes, that's what comes with Oxbridge. And Oxbridge is one of those things, I mean, I don't really think we speak about it too much in this PowerPoint, but I think definitely there's a lot of advice on Oxbridge, and especially on the Medic Portal website, if you are interested in knowing more about the Oxbridge variant. So common MMI stations. Now, I know I've done a lot of talking so far, and it's a lot to take on. So hopefully you guys are keeping on board with me here. So with what we've spoken about so far, it's what the types of interviews are. So now we've had a little dissection into the types of interviews. We can go a little bit further, and we're going to talk specifically about MMI. So common MMI stations. So it's really dependent on what the universities are stating specifically on their website. If in doubt, like I said, the best place to get your resources are from the university itself. They will tell you either on the website, or when you get an interview, they'll send you a bunch of information about what they're looking for, and they'll tell you the categories. And based on those categories, you can kind of adjust what kind of prep you're doing. So of course, this may change, or they may ask other things as well. So we really do recommend kind of being really well-rounded. But there are a lot of different categories to look at. So these are just some examples of MMI specific skills. So what they're going to send, other than like role play, for example, they're going to send you a skill they're going to ask you about. And now the skill can come in a lot of different ways. It might be a task, it might be a question. So it's really good to think about a few different ways to go about it and how that really demonstrates for yourself. So having a look just here, right, we've got communication skills. Now, from my experience of doing interviews, communication skills comes in a lot of different ways. So it could be role play. It could be explaining a task. So we've seen things like, for example, explaining to a 5-year-old how to tie a shoe. Or communication, they could ask you about ways you've demonstrated communication. And you might actually give an example, and you might say, well, you know, I did this volunteering and these are the skills I use. So those are some of the classic communication skills. We've had professional judgment, which we're going to talk about a little as well. And that's really about kind of how you behave and what kind of conduct you have in a professional environment. With empathy, which is a very classic one, a very important skill for medicine. So with empathy, you've got things like you've got your role play, they'll ask you questions about empathy, you've got problem solving. Now, once again, these things we'll discuss. Problem solving is very classic, and they might ask you for an example, they might actually give you a problem to solve. So it can really vary in the ways they do problem solving, but it can be things like they might ask you to put things into an order, or rank things you'll do, or rank places you'll go, or they'll give you some really strange examples like you're lost in this city and you don't speak the language and you've lost your friends. What are you going to do? You have to problem solve. So it's never, and the thing about problem solving, which is a really good thing to mention, is that it's never really what we expect. I think quite often people with problem solving get a bit thrown off by the question because it's very eccentric questions, or it might be really difficult questions. The thing about problem solving is it's never really about the right answer. It's about how you get there. That's what's very, very important. So number 5 is data interpretation and numeracy. Now, a few unis have them and a few don't. They'll definitely mention if they do. So this could be things like they'll give you a graph and you'll have to interpret the data, or they might do some calculation-based ones. So it might be about drug calculations. Now, bear in mind, these aren't going to be crazy eccentric calculations. They're going to be things like just some basic kind of converting from grams to milligrams, liters to milliliters, things like that. Once again, I think the Medic Portal has some really great advice on this. And number 6 is comprehension. And finally, we have video station. Now, video stations is a little bit more, well, from my personal opinion, a little bit more of a new thing over the last few years that we've seen pop up a bit more. And video stations come in a few different forms. So I've heard of universities, and I can't quite quote which university it is, but I think it might be Hull and York, which did this situation where instead of a role play, they had a video station, and they played the video and then asked the student for interpretation on what they would say. Then they resume the video, and then it's whatever happens next happens in that department. And then they're like, okay, how would you change communication? What would you do now? And then they play the remaining video. So there can be video stations like that. Those are some things we're seeing. Or they might play you a video and ask you to interpret and see the skills that you've recognized. It might be a consultation between a GP and a patient, and you've kind of got to think, okay, what are the skills I saw the GP did? What was the good? What was the bad? What made the patient feel good? So those are kind of things we can see in video stations. So starting with professionalism. So this is a test of your honesty, integrity, and morals. And this is a really, really big category in professionalism. You know, they're very, very big on it. So some of the top tips that I'm going to go through and then I'm going to kind of talk you through as well is starting with read the GMC's Achieving Good Medical Practice document. Now, this is, I think, a really good one to do. So GMC, I mean, no better place to start with than the official website. So for those of you who don't know, the GMC is the medical council that we use here in the UK. They're the people that are going to give you the license, and all our skill sets and the standard for medical professionals comes from the GMC. So it's very important we follow their guidelines. So reading their document just gives you an idea of what they want you to do. And many of you will have sat the UCAT at this point. Well, obviously you'll have to sat the UCAT at this point. And if you guys remember from your SJT, quite often the right thing to do isn't necessarily what we think. We had to learn what they wanted. And I think this is very similar. So, some things that you think are the right thing to do may differ a little from what the GMC would want. And in the same way we had to learn what the SJT wanted, we're going to learn what the GMC wants here. So be aware of the importance of whistleblowing. So, I'm going to give the example first, and I'm going to discuss a little bit what this means. So, for example, the Francis report based on the Mid Staffordshire Trust show that many staff were not highlighting their concerns about the care being delivered to patients. Now, as some of you guys may remember from your SJT, sometimes we get that uncomfortable question where one of our peers or one of our colleagues wasn't doing the right thing, and we thought to ourselves, should I tell on them, should I not? And it felt a little bit uncomfortable, kind of tattletaling on our colleagues. However, it was always the right thing to do. There's nothing more important than the patient. And you'll see a very repeated theme, especially in interviews about professionalism, about doing the right thing. You have to tell authority and you have to do the right thing and let people know if the wrong thing is happening. Whistleblowing is very, very important. However, understandably, it can be a little bit uncomfortable to kind of in a way tell on your colleagues, and especially in role play scenarios when you have a situation, for example, where one of your peers is trying to cheat and you have to tell them that's not the right thing to do, and if they do it, you have to escalate to authority. It can often cause quite a vivid reaction, and I think that really gets people a little bit uncomfortable. However, it is the right thing to do, and remember, you're being a professional here. You're not being kind of just a normal friend or character. So that's very important to note as well. And you have to show you understand the consequences of not acting. It is just as bad to be a bystander than it is to be the perpetrator. And that's a very key part of professionalism, and one that I really recommend you guys get very comfortable with, because it can be one of the more uncomfortable things in the interviews. So going on from professionalism, we're going to talk a little bit about problem solving. So problem solving or prioritization. So this is testing your ability to think critically under pressure. Now, this can be quite stressful, no doubt. I mean, you are being told to think under pressure. So when you kind of go about these stations, it's very easy to let the nerves get the best of you. And the title of this entire thing is From Nerves to Confidence. And it's easy for me to sit here and say, guys, be confident, just kind of brace yourself and get into it. And it's a lot harder to actually do it. So when it comes to problem solving and prioritization, my key advice before we even have a look at this is take a deep breath. You know your things, justify yourself. The very important thing, which a lot of people, I think, try to ignore, is that there is no correct answer whatsoever. And I think, obviously, as medical students, we know you're smart and we know that you're very used to your very academic lifestyle where there is one correct answer. In interviews and problem solving, there is not one correct answer. And when you take away that pressure of I have to find the perfect thing, you realize that we're just trying to see, okay, do they crack under pressure, and can they say their reasoning? Can they justify themselves? That's what's important. So here we have a question example, right? So you're told you're going on a camping trip. Before you is a table of random objects. You have 20 seconds to pick 5 objects you deem to be of importance and value and explain your choice. Now, the key thing here I want you guys to notice is explain your choice. Very, very important. So when you're doing this kind of question, some people may think there's a really obvious answer, and some people may think, the underdogs are the more important things. No matter what, it's the way you justify yourself. And one of the things I give advice as well when it comes to problem solving is think about what would you actually do. In a lot of these questions, think about who you are in the scenario. If, for example, I'm going on a camping trip and I have to pick 5 objects, think about what skill set do I have? What can I actually do and what can I actually use? And that way, when you have to justify yourself, you have proper reasoning. So if we look at our tips, don't panic. It's very easy to get overwhelmed in these stations. Take some time. Gather yourself is a good idea. I'm personally a very big advocate. 3 deep breaths before you go into the interview room. Deep breath in, deep breath out. You've got this. You know your stuff. Keep your mind clear. You are just answering honestly. That's all it is, okay? And then voice your reasoning aloud. This is very important. That is what we're marking you on, and that's the very important aspect. We're judging you and using this as criteria is what is your explanation? How can you tell me what you need without just telling me, oh, I'm going to use this? This shows the examiner, as it says, that you are able to think clearly in pressured situations. And the final one, for prioritization tasks, there isn't a correct answer, as I've just mentioned. So make sure you justify each decision clearly. And when it comes to justification, I think it's easier for me to sit here and say you need to justify an answer and harder for you guys to do it. So like I said, the key things, think about who you are, what you can do, what you think is important, and then go from there. What's important to you may not be important to other people. You have to be able to justify yourself. That's the important thing here. So the next one is role play. So many stations of role play. I mean, you can have problem solving and role play, empathy and role play, lots of things. So some of the key ones we have are breaking bad news. Very classic and a very difficult one, to be honest. So for example, you might say that it might be like the neighbor's dog you've been looking after has gone missing. So what are you going to do? How are you going to handle it? That's very, very important. So there's breaking bad news. The next is professional judgment. So you are a first-year medical student raising a concern with a senior colleague. This is one of those things where, you have to be able to escalate in the correct way. And the third might be conflict resolution. So you might have a member of your team is in dispute with another team member. How are you going to calm everyone down? Now, when it comes to role play, there's 2 things to think about. So first of all is, the scenario itself. The second is how to handle role play itself. And I say this from my own personal experience as well. When it comes to role play, I think it throws people off a little bit because you can get anyone and anything reacting in any way, shape, or form. I mean, and I'm going to give you guys a heads up here. In many role plays, that we've had actors cry, we've had actors yell, we've had actors kind of go all out. There is no controlling it. And I give myself as an example here because this was a role play that I actually had in one of my real interviews that really threw me off. So I did a Leicester interview about, 4 or 5 years ago now. And the lady I had was an alcoholic. And she'd come in and I think she was having an appointment with, I think it was social services. And this lady was a very good actor. She was slurring her words. She was getting aggressive at me, a lot of these things. And it really threw me off because I wasn't prepared for that. So when it comes to role play, the main thing before you even look at the scenario is prepare yourself for other people's emotions. You have to remain calm. The thing that I like to say to all my students is, the actor is going to react no matter what. That is the actor's job. They have to make it difficult for you. That is their purpose. So don't be alarmed if the actor takes it one way or another. They're doing that on purpose. It's not anything that you've done. You remain calm and try to de-escalate the situation and help the best you can. Okay, that's the important things. So tips for role play stations. Read the scenario carefully. Now, this is very good. Who are you in this situation? So are you a member of the team or the captain of the team? Now, this is important because this is going to help you decide what is your responsibility? What do you have to do? And what can you do? If you're, for example, a member of the team, do you have the authority to be punishing members of the team, or do you have to escalate it to the captain? If you're the captain of the team, is it your responsibility to talk to these people and figure out what's going on? If, for example, you're a medical student, can you talk to a patient about their diagnosis and treatment? That's a big no-no, right? So as a medical student, you need to know your limits. You're not allowed to diagnose or treat. So if a patient comes up to you asking for you to explain, their test results, that's not within your job role. So you need to think, what can I do? What can I not do? And then who can I ask for help when necessary? So those are very important things to think about. Make sure you communicate effectively. Communication, I like to say communication is made of 3 things: Verbal, non-verbal, active listening. When it comes to verbal, it's your classic, the way you say things. But think about who you're talking to. If you're a medical professional talking to the general public, am I going to say big fancy terms? If I'm talking to a child, how am I going to speak to them? If I'm talking to my friend, that's going to be different to talking to a family member. So think about those things. Then we've got non-verbal. So it's like your eye contact, your body language, your tone. Those are all very key non-verbal features. And the third is active listening. Now, this is a very, very misrepresented thing in communication. If you're going to talk to someone and you're going to have good communication, you need to be able to listen to what this person is saying to you. You need to be able to understand what this person is saying to you. If you're not hearing the person you're talking to, then you're not having a good conversation. You're just having a conversation with yourself. So in role play, and this is a very big point, when, for example, you're breaking bad news and you're trying to offer solutions. If, for example, let's give a hypothetical, like, for example, I've broken your laptop, and I'm telling you, no, I'm sorry, I'm going to do this, I'm going to do that, blah blah blah, and the person opposite you is telling you that they've got a really big project, etc., etc. If I'm offering solutions saying, oh, I'm going to buy you a new laptop, or I'm going to fix your laptop, but the person opposite me is telling me that the reason they're so upset is because they've got a project due tomorrow, I'm not giving them good solutions because I'm not listening to them. But if I listen to them and I hear the fact that they've got a project due tomorrow, I might say, well, you know what, I'm going to sit and help you write this project tonight. I will tell your school personally that I'm responsible for this. Things like that. If you want to have good communication, you need to hear what the other person wants. You need to ask questions in order to get responses, in order to understand. And the next one is, if giving bad news, show empathy. This is very important. Give a warning shot. So I have some bad news to deliver, and then deliver the news directly, but pause afterwards. So to break this down, I'm a very strong believer. There's a very set principle when it comes to breaking bad news. First of all, you're going to go into the situation, introduce yourself, then you're going to get straight to the point. So first of all, give a warning shot. Now, in a warning shot, there's a few things to think about. First of all, you might say something like, I do have something I'd like to talk to you about. I have some bad news. Then think about time and place. Is this the right time to say it? Are you okay if I talk to you about this now? Is it okay if I talk to you about this in 5 minutes, if that's better for you? Whatever it may be. Next one is place. If you're delivering bad news and you're in a hospital, but you're in the waiting room, is that the right place to do it? No. So you might say, if you would like, we can go to a side room. Would you like any of your family members with you? Is there anyone you'd like to call? Anything like that is giving the warning shot, preparing them for the situation. But then once you've given your warning shot, straight into the bad news. The biggest mistake people make is they get very nervous with the bad news, and they kind of and ah, and they break it down a bit too slowly. The actor's job is to make it difficult for you. If, for example, I have to break the bad news that I've done your injection wrong and I've got to redo it. There's normally two parts to the breaking bad news. There's the bad thing, and then the fact that, like, you can't fix it. So, for example, I've done your injection wrong and I have to re-give it to you. If I say, I've done the warning shot, I'm like, well, I've given your injection wrong, and in the time I'm saying, the actor's going to attack. They're going to say, oh my goodness, you've done my injection wrong, da 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 da. If I go, unfortunately, I've made a really grave mistake and I've done your injection wrong, which unfortunately means I have to do it again. I'm incredibly sorry. That gives the actor no time to react, and then they react. Now, you have to let the actor feel what they want to feel, but very important, the actor is going to react. That's very important to remember, because people think they're going to break the bad news and then they get nervous when the actor gets upset. That's the actor's job. Let them get upset, let them feel. It's breaking bad news. Bad news is never going to be an easy thing to do. You need to be comfortable with receiving emotion. That's very important. Let them feel what they want to feel, then try and de-escalate the situation. Ask them how you can help, offer solutions. What can you do next? And sometimes you might want to think, is there a prop? If there's a prop, what are you going to do with it? This might be a completely different one. Instead of breaking bad news, you might have to explain something to someone. So it might be a role play station of a communication skills where you might have to explain to someone how to draw something. So how are you going to tell them to use that pen and paper? Those are all very important things in a role play station. So in terms of my top tips, so let me see. Yeah, so in terms of my top tips, I've kind of spoken to you guys about how to handle those role play scenarios. Now, if I'm going to break it back down kind of to the scratch, take it right back to the start for interviews, there's a few key things that I'd like to discuss. So first things first, when it comes to, so starting with MMI, when it comes to MMI, starting with actually going from room to room, and I mentioned this a bit earlier, just remember that it does, from each station, from one station to the next, they don't know what happens in the previous station. They don't know what happens in the next. It's kind of like your UCAT. If verbal reasoning didn't go well, it doesn't affect your decision making. If decision making didn't go well, it doesn't affect your quantitative reasoning. Each station is different. The examiners don't talk between themselves. They don't cross check each station. Each station is marked individually. If one thing doesn't go well, it's okay. Take a deep breath. You have 8 other stations to prove yourself. You've got this. Take your time. Now, when it comes to preparing for the interviews, there's lots of great resources. And I really recommend that when you're doing these interview practices, work with lots of different people, even your non-medic friends. So ask them to ask the question, to do the role play. I mean, you guys would be in school, some of you. So if you're in school, any drama theatre friends, have them do the role play stations. I mean, who's going to be a better actor than your drama friends? So have them get involved. The more people you experience, the more diverse your reactions will be, and the more equipped you're going to be to handle different reactions in role plays. Now, in terms of things like your stations, such as like, why do I want to do medicine and things like that, reflect on your personal statement, but also remember you're trying to justify yourself. So you also have a time limit as well. Make sure you talk about yourself, and make sure you do it in a way that's not too arrogant, but works in a way that you can explain yourself. So for example, the absolute classic question of why medicine is the one that trips people up a lot, and it's one that you're probably going to have to prepare. When you're talking about why medicine, think about things like, what have you done to prepare yourself for the career, your work experiences, your volunteering, what skill set do you have? Why choose medicine based on what you've seen? So what doctor has inspired you? You know, those are the key things we'd like you to discuss in the interviews. And when it comes to talking about your skill set, I mean, they love questions like, you know, give me an example of teamwork, give me an example of communication, give me an example of, you know, your commitment to something. Have examples ready. What I think is a really great thing to do for interviews is have like a little diary or like a document or whatever, and think of every skill set they could ask you, and then make an example for each one, just so you have that prepared and at the top of your mind. But at the same side, on the same thing, on the flip side, is don't sound robotic. It's a very classic thing that happens. You're not trying to memorize an answer. You're trying to justify yourself. You can think about the things that you want to talk about. You can think about the things that are related, but don't create paragraphs and memorize them, because we can tell when you guys memorize them. We want you to sound authentic and genuine. So those are very, very important things as well. So those are some of kind of my top tips when it comes to interviews. So how to turn interviews into offers. So make the most of free, guys. I mean, Medic Portal has some really great resources. And actually another top tip that I do want to mention, NHS Hot Topics is a very, very common theme, very popular thing that you're going to get asked. Have a look. So if you look up the Medic Portal NHS Hot Topics, we have an incredible page which is really extensive and has everything. Definitely recommend, you know, start working through it now, and just maybe like, you know, every few days or once a week, just have a look through 1 or 2 of those hot topics and learn some key facts. I think you don't need to know everything. Know some key facts that are translatable to everything, okay? And then also kind of read the recent articles. NHS Hot Topics is a constantly evolving thing. So kind of read recent articles, really get involved in that, and that's what's going to help you really make sure you're on top for medicine. So number 2 is learn the doctor designed interview strategies at our 1-day courses. We have really great courses. And these are one of the things that I do teach as well. So we do them at schools. We also have ones from the Medic Portal. These are really great interview courses. You know, they really tell you about, you know, the kind of things you want to talk about. So that's definitely something I would get involved in. Number 3 is stimulate a 20-station MMI experience. So we also have a very, very cool thing where we actually give you guys an example of what the MMI experience is like. So we host in a building in London, and we have 10 examiners come in. So we have students, so current medical students and doctors come on in, and we also have actors as well that come in. And we set up a station. So we set up 10 stations, and you guys work in pairs. So you get 20 experiences. And you guys get to trial and get feedback as well, hot feedback on how you guys do. And I think there's no better way to prepare for an interview than to actually just do it and go through it. Number 4 is practice, practice, practice. And we've got 30, so we've got online mocks as well that you guys can sign up for. So those are really great. Those are 1-to-1 with tutors. And then finally, get uni-specific advice with tutoring and our 1-week boot camp. So these are all really great packages we offer. And kind of going along the final point as well, There is no one better. So one of the classic questions you're going to get as well is why this university? There is no better way to know than to actually ask a university student. So whether we, I mean, at the Medic Portal, we have kids from all the universities, like we're very extensive, but you can also just get involved in every university has one social media influencer in some way, shape, or form. Get in touch with them, pop them a DM, pop them an email, talk to somebody, come into the open days, talk to the people here ourselves, because we're going to know the university and the course better than anyone else's. Okay. So that's something I really, really recommend as well. So we do have some really great deals as well. So if you guys want to take a picture of this, we've got some really popular interview tool stuff and some deals. So it's definitely something to look forward to. So feel free to take a picture of this. So we are now coming to the end. So I'm just going to pop back onto here. I know it's been a lot of talking at people. Let's have a look. So let me see how this works. So I'm not sure how questions work. I'm not sure if Dukes can talk.
Yeah, so we've had 2 questions pop up about the slides being sent, which I have responded to for you. But there are 2 people that have their hands up.
I unfortunately can't
now
see.
we have 3 people. So Amina had her hand up to start with, and I'm assuming that might be about the slides. So
I can do allow to talk. Shall I do that? So I do them one by one?
Fantastic. That would be brilliant.
Wonderful.
Yeah.
Okay, so Amina, I'm going to allow to talk. So hi, Amina. I hope I'm saying your name right. So please do ask away.
Hello, hi. I'm so sorry for joining in late, but your presentation was amazing. Thank you so much for the information. I just had a quick question, which I'm really kind of struggling on. One of the common questions I believe they ask is like, yes, they can ask me like, why do you want to be a doctor? But one of the things that I struggle with is when they say, why do you want to be a doctor instead of another healthcare professional, such as a nurse? What would you say, like generically, things that I should cover and like discuss in that scenario?
100%. This is a really great question.
Thank you.
This is one of those things. So yeah, thank you very much for your question. This is a very classic question. So in my personal opinion, when it comes to why a doctor, not another healthcare professional, there's 2 things I would do. First things first, and you can really do this like online as well. I would look up like what is the difference in their job descriptions. That's very, very important. So then you can kind of explain the difference. And number 2, reflect on your work experience. They love in these questions when you can reflect like, oh, in my work experience, I saw kind of this job role and that job role, and these are the differences. So there's a few things you can do when it comes to this question. So first of all, when you talk about the question, the first mark you're going to get is showing appreciation for both job roles. So say I'm going to say nurse, doctor versus nurse in this, right? So I might say, both doctors and nurses are incredible and they're very valuable to the healthcare system. I've actually had the pleasure of experiencing both in my work experience. And then the best thing that I like to do, so there's a little phrase I like to use, which goes, I think I am more suited to the role of a doctor. And that way you kind of get out of saying, because it's very classic that people find it difficult to say like, oh, I'd rather be a doctor, which is not the thing you want to say, because that sounds like you're putting down the other healthcare profession. I would say something like, I think I'm more suited to the role of a doctor. And then you can go into describing what the job role differences are and then kind of connect them to yourself. So for example, I might say, I find that I'm more suited to the role of a doctor compared to that of a nurse or another healthcare professional due to the leadership opportunities available. So I myself have had a few opportunities to do leadership roles. For example, I worked in such and such charity where I worked with various different members, and I found myself really enjoying that position. And I think that's something that the role of a doctor can offer me. And that way you're not putting anyone down, but you're explaining why medicine is more suited for you than any other healthcare profession. So I think that's a really great question. A lot of people go back and forth between them. So I would definitely say start by differentiating the job roles and then think about what job roles in a doctor and what skill set do they have that may differ from other healthcare professionals and why that relates to you. So, and for example, the reason I say like working with different roles, say for example is leadership. A doctor has leadership roles, and they lead the MDT, and you might link that back to your work experience. But for example, a nurse also has leadership roles, and we've got head nurses, charge nurses, we've got specialist nurses. They're also leaders, but their leadership is different because they are often leaders within other nurses. But a doctor is a leader within MDT. So that way, and then I would relate it back to the work experience or like whatever experience I've had where I've been a leader amongst different people, and therefore I'm more suited to the role of a doctor. Does that make sense?
Yeah, a lot. Thank you so much.
No worries. So I hope that answers one. And I think, oh, we've got another one. Oh, and also, so I see there's a Q&A function. So I'll also do the hands up and I'll kind of go back and forth in the Q&A. So I can see, okay, so for MMI interviews, do I need to keep talking for the entirety of the interview, or can I stop talking when I'm done? You can definitely stop talking when you're done. They might have a follow-up question if they feel like they need to fill in the space, or they might just move on to the next question. Just because sometimes if you feel like you're rambling, there's no point, just get to the key points. You can definitely stop talking when you're done. Okay. And then, do we need to know about the NHS structure, or is it a common topic? So NHS structure is not so much one that I've actually heard people talking about in interviews, but I think it's definitely a good one. Just have a brief read over, just understand that there's different systems in the NHS, and just understand like kind of what kind of issues there may be in different parts of infrastructure, but it's not one that I've heard of much. But it's just nice to have a little skim read over. If you find yourself in the interview and they've asked you something you don't know, just be honest. Don't worry about it. Say for example, like in one of my interviews, there's this one thing which is like the 6 C's of the NHS or something like that. Yeah, the 6 C's, I think it was what I got. I didn't know what they were. So I was like, I'm so sorry. I don't think I'm familiar with the 6 C's. Could you please explain them to me? Then she said them to me, and then I gave my opinion on them. So worst comes to worst, they ask you hypothetically about NHS structure, which is rare. Just be like, I'm sorry, I'm not familiar with it. And if you can give me a little bit of guidance, I can tell you what I do know. So that's one thing you can do. So brilliant. And then what documents do you think we should read? Definitely think kind of GMC. So GMC guidelines is a great one. I think the best documents, the medic portal pages are really good. I think those are the documents as such to read. They've got it really clear and concise. If it's documents, I would say just recent articles, and the GMC's professionalism is the only things that I would really like officially read. How do I talk with more confidence and convictions? What can I do to train this? This is a really good question. Confidence is such a difficult thing to get sometimes. But I think, first of all, practice. And also practice with different people. The more random people you have to explain your answer in front of, the more you break down that kind of fear of like, oh, like, how am I going to say this? How am I going to say that? So I think talking to different people, very, very helpful. And the other thing to improve confidence is learn to justify yourself. When you know why you're doing, so for example, if they ask me about teamwork, I know I have good teamwork. I demonstrate that on a daily basis, so therefore I can say it. So one thing I would do is something that really helped me is I made like a separate CV aside from my personal statement, which just talked about all the different skill sets. And this is what I was talking about earlier. So write out the skill sets and write examples. When you're able to justify yourself, you're definitely more confident. And the next thing is, just pretend you're talking to yourself. I think I'm also someone who gets very nervous talking to new people sometimes, especially back when I was doing interviews. So when I was talking to the examiner, I just pretended I was talking to someone I knew. It didn't matter. In my head, I was gaslighting myself. I was not looking at I was looking at the examiner thinking, yeah, you're my best friend. Let me just talk to you. That I think helped me a little bit. So let me get that one. So hopefully that answered that. Okay, do we need to know about famous medical cases? Not necessarily. I think keep on top of recent news, but I cannot actually quote a time they asked any of my students or anyone that I know a specific famous medical case, but it's good to have ones you can quote. But like I said, if they ask you anything specific, all you have to do is be honest and just be like, I'm not actually too familiar with this case. If you can tell me the general gist of it, I can try and explain from it, but read recent news. But they won't ask you about something too specific because it's a bit unfair because they don't know who knows what. But general factors, yes, they would expect you to know. How many work experience placements do you need and where? I'm a strong believer, it's not more is better, it's what you can actually talk about. So I think one good work experience where you can actually reflect, and maybe one volunteering. If you haven't managed to get work experience, that's not the end of the world. It is preferred. It is quite important to get work experience, but you can do it in different scenarios. So you can do care home work experience, things like that. I think no more than one work experience or one volunteering is absolutely essential. But if you have more, that's great. It just means you get to explore more of medicine. So we always encourage as many as you can do, but all you need to have is bare minimum one that you can very confidently talk about. We would recommend a clinical setting. So just so you can prove that you've seen a doctor. So whether it be hospital, GP practice, whatever you like. Those are the things I recommend when it comes to work experience about where. But in terms of volunteering, it can be anything. It can be charity shop, it can be care home, it could be something, it could be tutoring, whatever work volunteering you want. It's just about the skill set you gain from that. What is the best way to structure different types of answers for different MMI stations? That's a very good question. I think it really depends on the MMI. So unfortunately, I think that one's quite a long one to answer. I think for that one, definitely have a look at the website. I think they've got some key ones. We do have 2 more webinars rolling out next week and the week after. I think those webinars we'll discuss it a bit more, because it really just does depend on each kind of station in a nutshell. So I'm so sorry, that was not the best answer I could give you there. I wish I could give you more information, but it really depends. If you guys have any specific ones, hopefully I can answer them a bit better. Hi, when you are talking with the actor, I assume the performance will be watched or marked by an interviewer, or is it just you and the actor? It is you, the actor, and the examiner, but the examiner doesn't say a word the entire time and sits in the corner, so they basically don't exist. You're only performing with the actor. And as soon as you enter the station, the scenario started. There is no like, oh, any awkwardness. The actor's on the go from the second you step in. Will they ask you about your extracurriculars? If so, what extracurriculars do they like? They can ask you about extracurriculars in 2 formats. They can ask you about ones that show your skill set, or they can ask you about non-academic extracurriculars. Now, they have no preference as to what extracurriculars they like. It's ones that show a skill set. So you could do anything under the sun, as long as you can tell me, like, has it shown you teamwork? Have you demonstrated leadership? Have you demonstrated commitment? Have you persevered during a tough time? So it's not so much what extracurricular, it's what can you say about the extracurricular. So what skill set can you demonstrate from it is what. So it could be anything. Your extracurricular could be cleaning, and it's just about, have you shown commitment to cleaning? That shows organization skills? Have you had to have time management in it? That's what they mean by it. Oh, thank you for the talk. In my MMIs, there's a situational judgment station. Is that likely a problem solving? Situational judgment is more likely going to be a professionalism station. I think it depends on which one, but it might be a cross between problem solving and professionalism. But it's going to be like SJT from the UCAT most likely. So, for example, you've seen a consultant who smells like alcohol, something like that. So we'll have elements of problem solving about what you can do about it, but it's probably going to have the professionalism aspect more to it. Which are good sources of knowledge for the doctor line, e.g. if they ask how I stay up to date? Oh, good question. So who to look, what resources to look for, like up-to-date information and things like that. I recommend things like BMJ. So BMJ is a really great resource. GMC, you can do BBC News. Those are kind of my favorites for up-to-date articles. BMG is my absolute favorite because they kind of release things regularly. So I think it's like the British Medical Journal. They're a really good one that I recommend. And yeah, I think reading them is enough. Like, just keep generally up to date. Just have one thing that you can at least talk about. Would going to things like conferences or volunteering outside of medicine matter? They can do. It's more about, like I said, and this is a very common theme you're going to hear a lot, it's not about where you go, what you do, is what you learn. So if you go to a conference, what did you get from the conference? What did you learn? Who did you meet? What kind of things did you experience? That's what matters. If you're going to do volunteering, what skill set have you developed? How have you pushed further on that skill set? Or maybe you realize that you're not so good at communicating, so what did you do to fix that? Those are the things they want to know. I think it's not about doing 100 things. It's about doing a few with good intention and with good demonstration of skills. How do you think we should answer questions about hot topics? Is there any structure we should follow? Can they ask niche topics we may not have views about? Very good question. So in terms of hot topics, they can ask you questions about any hot topic. Some of the favorites they've had recently is AI, aging population. I think Brighton and Sussex had one about climate change like last year or year before, which really threw people off. That one was a niche topic. It was like, how is climate change affecting medicine, which is very niche. If they ask you niche topics, it's not going to be something that's like, this specific person, this specific case. It's going to be more broad than that. But if in doubt, just simply say, this is not a topic I'm too familiar with, but if I was to discuss on what I do know, such and such and such. When it comes to a hot topic situation, if they ask me, like, what's my opinion on such and such hot topic, I do have a structure that I really like to use. First thing, so in the structure, the first step is just to acknowledge that there's multiple layers. That way you're kind of covering yourself, because you're kind of saying like, I understand there's multiple layers, I may not talk about everything, blah, blah, blah. So I would start with something like, this hot topic is a particularly interesting one with multiple layers. I think there's a lot of varying opinions. And then you want to talk, the next thing is do both sides of the coin. People talk about a hot topic and go, say, for example, I'm going to talk about, let's say aging population, and I might just go into all the negatives of aging population, but that would be not so much like a good understanding. A good understanding is someone who has a well-rounded opinion of something. So I might talk about the pros, the cons, what we might do about it, and then I would do like a bit of a back and forth, but then in the end I would give a concluding statement of like 1 or 2 sentences. If they're asking for my opinion of something, I always like to use the structure of like give an opinion. So I might say, in my opinion, the aging population is a genuine concern, but as of right now, I'm more open to reading more and understanding more on the topic, and my opinion is subject to change. So sometimes if you want to cover yourself and you're talking about a hot topic and you're not too sure, I like to give that statement like, I'm going to continue reading. This is something that's continuously evolving. So that's how I would answer a hot topic question. Could they ask you which area you would like to specialize in, as I'm not too sure yet? They might do. I don't really think I've heard a question. They can do. And if you're not too sure yet, that's completely fine. I would just have one just for my go-to scapegoat answer for that is use one from your work experience. So whatever area you cover in your work experience, just say that specialty, because then you can talk about the work experience and give the examples and stuff like that. So you kind of get away with it almost. But just think about what you're interested in as well. So if you like working with children, say pediatrics. If you like research, talk about, oncology or cancer department, because there's lots of continuous research about that, those kind of things. So you don't have to have a special, there's no expectation for you to have a specialty that you're interested in. But if in doubt, do one from your work experience, or do one which relates to something you talk about. At the end of the day, you always want to relate it back to yourself and your skills. That's the most important thing. Do you recommend any other free resources in addition to GMC and the Medic Portal website? Oh, definitely. I think if you literally Google, I think there's like things like Blackstone Tutor, things like that. There's lots of there's no specific one I recommend. I think everything's incredible. So just literally search it up, have a look online. YouTube videos are great. I'm not particularly sure of anyone that I think is the most recommended, but for example, there's also TikTokers, I'm sure in this generation, as you guys are all on TikTok as much as I am. So for example, I have a peer of mine, she's called Yosha. I think her Instagram handle is Med Baddie or something like that. It's a very cute nickname. Med Baddie, she's great. She gives really great advice. She's top notch when it comes to this. So if you're looking for there's lots of TikTok videos and TikTokers who do really great. So Med Baddie's one I definitely recommend. She's incredible. She's a close friend of mine. So that's one I would do. Does work experience mean a job or is it shadowing? Work experience can be anything. It can be a job, it can be shadowing in the hospital, anything. As long as volunteering is a little bit different to work experience, but the work experience just has to be from a medical scenario. It has, as much as to our best ability, it can be a job, but we would think of that more in a little further away from the clinical work experience side. Thank you so much. You're welcome. I've applied for grad med at King's Portsmouth branch. Do you know what type of interviews they hold? I couldn't find information. The King's Portsmouth branch, I'm not too sure myself. I don't want to give you any false information, but what I would recommend doing is emailing King's admin. I think sometimes it can be hard to find the information online. Email them directly. Best way to go about doing it. I'm not particularly sure, but King's is quite infamous at MMI. They're very MMI, so it's most likely going to be something like MMI-esque, but I would definitely just email him because I don't want to give you the wrong information. When do you get to know if you pass the interview? It can be any point. I had some friends, so some of my interviews told me a week later. Some of my interviews didn't tell me till a month later. So it really does vary, completely dependent. They do normally give you a cutoff date. They're like, we'll tell you by May this point or March this point. But don't be alarmed if you don't hear back. It doesn't mean you haven't done well. They just need to go through thousands of applicants. So you might have been the first batch and they still have to get through 1,000 interviews before they decide to give you a space. So, and even if your friends do hear back first, it doesn't mean that you're not going to get it. It just means there's a lot of people to get through. And sometimes they have like a limit of how many people they're going to accept at one time. Because imagine they give away all their spots at once and then there's still like 500 people to interview. So that's no indication. But they will normally tell you a deadline. But I would say like maybe max a month is normally what we see. What was the hardest interview question or activity you had? Mine was definitely my role play in Leicester with the alcoholic lady, because I had never practiced role play before going into my interview, unfortunately. And the actor was very good. She was slurring her words. And I thought, so for example, this is sometimes when you get information about the interview on the outside, like outside the station, sometimes they'll give you the station, sometimes they're like, go in and talk to this person. So that's what I had. It literally said, go in and talk to this person. So I went in and I assumed that it was about a GP meeting. So I was like, hi, are you ready for your GP meeting? And she was like, what do you mean? I'm here for social services. They're trying to take my daughter. It was a very intense situation. So that was definitely the hardest interview question I've had. So definitely do recommend practicing your role play and practicing crazy role plays, because the more eccentric you try, the harder you do now, the easier the normal stuff will be for you. So yeah. How do you think we should answer questions about hot topics? Is there a structure? Oh, I think I've answered that one. What's a good balance between a personal story and professionalism in responses? In terms of, so the person who wrote the question, what's a good balance between personal story and professionalism responses? Do you mind clarifying exactly what you meant by that? Like, do you mean in a professionalism situation, or like when you're talking about your personal life and when you're trying to translate that into a question? So if you want to just clarify that for me and write that in the Q&A for me. What would be a good way to approach a question about your weaknesses and strengths in regard to skills? This is a very good question. In terms of strengths, you want to be confident but not egotistical. To be able to say something's a strength, you need to prove it. So say, for example, my strength is public speaking. And I would say that this is my strength because I've actually pushed myself outside of my comfort zone, and I've given courses and presentations as I have done today. And so this is something I'm quite confident in. So when I talk about my strength, I'm talking about how I've proven it and what makes me know that I'm good at it, but without saying like, oh, I'm so amazing. It's more of like I've constantly put myself out there and I'm continuously working on it, which is what makes me think that this is my strength. Now, weaknesses. This is such a great question, and I think this is such a good one to know about. When they ask things like, what's your weakness? I have a structure that I really like to use, and it's very similar to one that Medic Portal kind of demonstrates as well. So say, for example, my weakness is time management. When you talk about your weakness, you don't want to say, because I think a lot of people shy away from saying a weakness because they don't want to seem like they're a bad candidate. Everybody has a weakness. We love when people can admit that there's something they're not so good at. It's about what you say in the second part of the question. Whenever you talk about a disadvantage or a weakness, you want to talk about how you're going to overcome that. So I'm going to give my demonstration. So I might say, I find that one of my weaknesses would be time management. This is something that I've often struggled with, and it's something that I really found difficult when I was going through my last exam period. However, since that experience, I did really reflect on my time management skills, and I came to realize that I had a lack of organization, which is what led into the time management concerns. So so what I did was I had a look online and I researched into some time management skill sets, and I came to find that to-do lists were a really effective way of managing my time. So since then, I now do a weekly to-do list, and I try to make a priority ranking in that to-do list. And since then, I've been able to overcome some of that time management concerns, but I'm still actively working on it and continuously learning new ways that I can overcome this time management. So you're admitting to a weakness, but you never want to say, oh, I'm bad at something and leave it there. You want to talk about, what am I doing to change it? How am I figuring out how to change it? And you want to talk about actively doing it. And I think the best way is always adding in that little bit like, oh, like I'm currently working on it. It's getting better. It's not fully there yet, but it's getting better, and I'm going to continue working on it. That's what makes a good weakness question. Would there be a specific webinar for Oxbridge? There may be. I don't want you to quote me on that. I would, if in doubt, or you would like to know more about Oxbridge webinars, pop in an email to Medic Portal. They're really great. They reply super quick. They'll be able to tell you that one. Thank you so much. Oh, they're so sweet. You guys are most welcome. Hi, I did a mock MMI, and there was a math section where I had to do some calculations to work out drug dosages, and I struggled due to nerves. I was wondering how in general, how hard the maths questions can be. So first of all, well done for even getting out there and trying it. The first step is to try. I'm very, very proud of you for doing that, first of all. So the maths section, and it's completely fine to feel nervous about it because it's not the typical thing we expect. So the maths isn't going to be too difficult. It's just the calculations and going back and forth between them. If you look up drug calculations, MMI stations, there's some really good pages online. It's not going to get complex. It gets repetitive. As long as you learn how to go from the different units and how to be like, if it's 5 milliliters per kilogram and it's 72 kilograms, how do you comfortably to multiply by 72? That's what they're going to want you to do. So it's not going to be difficult maths. It's more going to be like, you need to know just those few skill sets. So I would definitely just look up. I know there's some really good pages. I can't quite quote them to you, but there are some really good pages. I know the Medic portal has some information. They have some clear working out. Have a look at those, I'd recommend. The role play station again, what do we practice on it? Like it's solving a medical problem or generalized base. Okay, so with role plays, it's always going to be things like breaking bad news, empathy, or communication. Those are the main things. Even problem solving is going to be something like, you've lost someone's dog. What are you going to do? You've accidentally done the wrong injection. So you're going to have breaking bad news. So I think the main things are breaking bad news, a communication, and then the third one, which I've already forgotten that I said. So to practice that, I would look up. So they have, if you just look up like a list of role play scenarios, do it with friends, do it with family, just do it with each other. But whoever's doing the role play, the actor side, ask them to go as extra as possible. The more extra they go, the even better. Because you've got to learn not to laugh in the role play as well. That's a really big one that people really struggle on. You've got to learn not to laugh in it. How would you go about answering a question along the lines of tell me about yourself or why should we pick you? Very good question. So when it comes to things like tell me about yourself, I like to say there's 3 categories. So the first category is your personal self. So like, what are your characteristics outside of medicine? The second is tell me about yourself in terms of your academic life. And the third is tell me about yourself in terms of your strengths. This is such a good one because when I do the interview courses, I actually ask students, okay, give me a fun fact about yourself. And people always struggle. If in doubt and someone asks you to tell you about yourself, remember, say the best thing. What's a recent achievement? What's your favorite hobby? What is something you're working towards? Those are things that I love to talk about. Try to keep them skill set based as well, just to really demonstrate yourself. If they ask, why should we pick you? Skill set, always skill set. Think about, what do I do now? So am I a leader? How do I demonstrate that? Have I been trying to get into medicine? What have I been reading? What can I offer to you? And along the lines of why should we pick you is along the lines of why do you want to come to this university? Think about what can you offer to the university? So aside from, your skill set into medicine, career, etc., have a look at the university and think, what societies do they have? What extracurricular hobbies? Because it's a very big misconception that you're applying to medical school and they want you to just be academic weapons. They want you to be a part of the university as well, whether it be a sports club, the cooking club, the henna society, the traditional societies, whatever it may be. You want to talk about that too, because you're a person marked past the medical textbook. We want to see your character outside of just medicine. So those are things, and that's people always miss the extracurriculars and the non-academic things. Think about what is special about you, or what defines you outside of that. And it could be anything. I mean, for example, I love cooking, so I might join cooking society, or my heritage is I'm Tamil Sri Lankan, so I joined Tamil society when I came here, and I really enjoyed it. That's something I wanted to contribute to the university. So that's things that you might say about yourself. So those are the kind of things that I would definitely add in there. With role play with a distressed patient, how would you approach them? Like, would you try and calm them down for a lot of the time? Or would you try to move on? This is a good question. When it comes to distressed patient, there's no way around it. You do want to try and calm them down and give a solution, but the calming down has an effect, right? So what the things I recommend when it comes to calming down a distressed patient, I always like to say, do things like ask them, oh, hey, so say, for example, I've broken some bad news and you're getting really upset with me. I'm like, I'm incredibly sorry. Don't say sorry too much. Say sorry with intention. So you might say, I'm incredibly sorry. I'm going to assure you I'm going to do my best to fix this. I'm incredibly sorry, but I'm going to work alongside you to make sure we figure out a solution. I'm very sorry, but how can I help you? What can I do next? When you're trying to de-escalate a situation, this is where active listening comes in. People make the mistake of trying to be like, oh, I want you to calm down, give them a tissue, like just sit there and wait for them to get better. proactively be like, you know, for example, I've missed your booking. I'm a waitress at a restaurant and I've missed your reservation. One of my favorite things to do would be like, ask them, what can I do? And they're obviously, the actor's going to be difficult. They're going to be like, oh, I want you to get me the reservation. What you can say is, I'm incredibly sorry. I really wish that there's something I could do in that department. In the worst case scenario, I can't find you a solution of a reservation tonight. What else can I do to help you? What else can I do to make you feel better? That's going to de-escalate the situation and find a solution. So it's like a 2 birds, 1 stone thing. That's one of the things I like to do in role play when they're quite distressed and you feel like maybe you're not getting to the solution bit. If talking about how much we developed a skill such as public speaking, but weren't successful during the task, should we include the example? Head prefect, you didn't end up doing 100%. When you talk about something that you didn't do well, and give the example, but make sure you demonstrate how you've overcome that or a success since then. So say, for example, I talk about public speaking, and I remember the very first course I taught at the Medic Portal, and I was such a bundle of nerves. Like, I think I was just all over the place. And I reflect on that. I think, you know, I quite often started and I wasn't able to answer the questions. However, since then, I continued to put myself outside the comfort zone, and I continued going to these courses, and I continued getting involved in presentations. And that allowed me to learn from my mistakes and get better. So it's always good to mention where you went wrong and give examples, as long as you're following that up with a positive example or a further demonstration of what you're doing to overcome that. Thank you so much. You're most welcome. Let's have a look. For role play, breaking bad news, communication, empathy, problem solving, those are the main ones when it comes to role play. I'm just going to have a look at the hands up and see if we've got any hands up. Oh, I've raised my own hand. Oh, I don't see any more hands up. Okay, sorry, I know that was a million miles per hour, because I know that we're running over a little bit, but hopefully I've answered as many of your questions as I have, and this has been hopefully a good introduction. I know with interviews there's a lot that there is to learn, but the biggest advice I can give you guys is that you've earned your spot here. They haven't asked you for an interview for no reason. You've demonstrated your skill set. You've got good personal statements. You've worked hard in your academics. You are here for a reason. You deserve to be in that interview just as much as the person before, after, and all the other interview applicants. That's very, very important to remember. So if in doubt and you're feeling nervous, just remind yourself you're in the same boat as everyone else and you 100% deserve to be there. So you're very welcome, guys. Is this recorded? Is a great question I have for Jukes. If whoever's here with me.
Hello. Yes, this is being recorded, but the slides will be sent out I would say by mid next week. Yeah.
Brilliant. So I think that's all the questions. So I hope I've been able to help you guys with some of this, and I hope that, you know, we'll maybe see you at the next webinar. So best of luck in case I don't see you guys again. But if I do, I will see you guys at the next webinar. I think that's all from me. So you guys, I think
brilliant.
Yeah.
It's brilliant. Thank you so much, Venetia. That was absolutely fantastic. Have a lovely evening.
Bye. Bye, guys.